with our young lady with the non-incisional injectable makeover. We've done our Kybella Belkyra in the chin and submentum, under the chin. After our double chin treatment, we did a Botox brow lift for the upper floor. And we're going to come back and do a little Juvederm refreshing of the mid-face, little volume lifting. Let's take a look at the early Botox results. So the Botox has had a bit of time to settle. You can see there's a very nice elevation at the tail of the brow. That's the Botox brow lift. A softening of the crow's feet. The frown scowl's gone. And it's really quite a nice result. But a very common side effect when trying to do Botox brow lifting is over elevation, or Leonard Nimoy brow, or spocking out, that sort of Jack Nicholson quizzical look. Lift your brows up, and that one goes a little too high. We use Botox to adjust that. So we're going to look at today a Botox treatment for overbrow elevation, which is not an uncommon adjustment. First we try to get the brow elevation, and then we adjust it. The treatment's very quick. It normalizes the brow so things look symmetrical. So we have the hyper elevated brow, and we want to adjust but not eliminate that elevation. So we take a little alcohol wipe. And the standard formula I've used for many years is I go halfway between the brow and where the hairline is, halfway in between, and 1 unit for every millimeter we want to drop the brow. So really only 1 unit is required here to soften this hyper elevation effect. And then we soften the horizontal line slightly. That small amount of injection will correct her Spock brow, and we'll see her back again in another week and see how that looks. The central part of her brow's fallen a bit, but if you watch her big smile, big squint, she now is starting to recruit her bunny lines here and her procera. So if we take these out of the equation, on either side of the nose called the bunny lines and this crunch line, the muscle that pulls down her central brow will relax and it'll lift up a bit. Okay, so we'll achieve that. And that should balance out her brows quite nicely. So we successfully have a softening of her crow's feet, a brow lift elevation, and opening of her eye with a Botox brow lift. Combined with our treatment of the chin area and the double chin treatment, we can now progress to our mid-face. The mid-face is the lift that gives her cheek shape back and softens the smile lines and lifts the corners of the mouth. So this is volume. This has been the use of Kybella or Belkyra and a Botox brow lift. The three together give an upper floor lift, a middle floor lift, and a basement lift. So double chin treatment, mid-face volumization and elevation, and Botox brow lifting, all done non-surgically and with simple injection. We've done our Kybella double chin work. We've done our Botox brow lift. The last area is the mid-face to get the volume shaping, using volume to restore shape and balance. If we look at the areas we're going to treat here, we want to create a nice elevation of this cheek and mid-face without looking like filler face. Soften the smile line, elevate the corner of the mouth. Again, a nice elevation of the cheek zone, soften the smile line and the marionette line without looking to inject it. And Voluma, Juvederm Voluma, is an excellent product for that. And so we're going to use a little micro cannula, and I use a little port creator where I go in the skin, create a nice angle, and then I'm going to remove that, head back just a bit, and we're going to take a little micro cannula and we're going to substitute our sharp port creator for a little micro cannula. No sharp edges on this, very safe way to inject. And it's very accurate and very much like we do fat grafting. Once we're under the skin, we're going to use a little Juvederm Voluma. A simple sugar gel, lasts 1 to 2 years, very safe. We're going to turn and go up the cheekbone a little bit, up the what's called the zygomatic arch. We take our Voluma, attach it to our syringe, and make a nice gentle contour shape improvement. You want to sneak up on the appropriate volume. You don't want to look like dreaded filler face. We're not making little balls, but making little tiny toothpicks of gel. Toothpicks of gel that add up to a very nice, soft, subtle, and supple contour improvement. So every time I advance my microcannula, I inject on the way back and lay down a little buttress of support, a little toothpick. And when I say toothpick, this is what it looks like. As I advance and pull back, I'm leaving that little toothpick of gel to provide structural support. And we do a number of these toothpicks. It looks very natural and doesn't feel or look bumpy. So again, we're building up that zygomatic arch to give that a little oomph, a little projection. And that will look very nice on her. Not too much. She's got a nice angular face, and we're just trying to open up that cheekbone to create a little bit of volume and shaping. The next zone is a smile line, which many patients don't like. And again, we use our port creator, and we take our little micro cannula, and we go to the smile line, and we get under the skin, and we're going to soften the smile line again with our Juvederm Voluma. We attach it to our micro cannula, and we inject under the smile line, soften it nicely. And there's a little anesthesia in this, so it provides some numbness as we go. Some numbness as we go. And we can improve that nicely. Excellent, very good. And then the last thing I do is the corner of the mouth with a little Juvederm on a special needle that comes with the syringe. We don't use a micro cannula for this. We just want to elevate the corner of the mouth and provides nice support right there in the corner, and turn the corner so it looks supported but not overturned. You don't want a Joker smile, but something that just horizontalizes the commissure nicely. And then I'm going to take our young lady here, and she'll hold a little bit of pressure, and we'll come back and take a look and see how the shape looks in a second. Welcome back with our volume shaping, our Voluma lifting. Juvederm Voluma in the cheek. You can see we've done a little injection in her what's called the malar eminence and cheekbone, smile line, and corner of the mouth and marionette line. And if we look at one side versus the other, you can see the depth of the smile line, the cheekbone, and the nice improvement on this side versus the other side. A very quick fix for getting that nice little elevation and shaping of the mid-face on one side versus the other. Welcome back, Dr. Mulholland Spa Medica. We have done our week after week makeover. Top floor, the brow and upper lid with a Botox brow lift. Bottom floor, Kybella for double chin work and jawline volume. And now here we are back looking at the mid-face. Juvederm Voluma lifting, getting the cheek smile line softened. Let's take a peek now. We've done our Juvederm Voluma. We've done both sides. No bruising, very little swelling, and you can already see a nice elevation of the cheek. We make the face a little more oval. This will come down a little bit because some of it is local anesthesia. The corners of the mouth are supported. They will horizontalize and soften. The over Botox elevation on this side will soften. So when we see her back, we'll see a lovely integration of double chin softening, Voluma lifting for the mid-face, smile line softening, and Botox brow lifting when we come back.